If you do not understand hair growth cycle, then no hair treatment in the world will make sense to you. In fact, many patients stop the right medical treatment for hair loss because they do not understand what is hair shedding. So in this video, let me tell you more about the normal hair cycle. I am Dr. Samiksha Tyagi, plastic and hair transplant surgeon. Many of my patients panic when they start to lose hair after starting the treatment because most of the time they don't know about the normal hair cycle. So let's understand more about it in detail. Most people believe one simple thing: hair falling means hair loss. This is not true. Hair falling is a very normal biological process, but the problem occurs when hair are falling and they are not growing back. So this is the condition which you need to understand. Every hair on your head undergoes a hair cycle. Now let's understand what is this hair cycle. The first phase is Anagen Phase, which is also called as growth phase. It is this phase which is the longest phase, which usually lasts around few years, from 2 to 6 years, on an average around 3 to 4 years. During this phase, your hair start to grow, they become thicker, lengthen over a period of time. On your scalp, on an average, around 80 to 90% of your hairs are in this anagen or growth phase cycle. The next one is Catagen Phase. This is also called as the transition phase. In this phase, your hair stops growing, and this is a very tiny phase which lasts around 3 weeks or so, but these hairs do not start shedding. After this phase, there comes a phase which is Telogen Phase, which is also called as resting or shedding phase. So during this phase, your hairs will not grow, and gradually over a period of time they will fall back or they will fall out. When you see your shedding hairs, actually this process has started months back, and now you are seeing the result of this. This phase usually lasts for 3 months or so. Usually around 10% of your total hairs are into this phase. To understand it in a simple way, let me give you one example. Suppose if you are going through some stressful situation like some fever or major illness, major surgery, stress, sudden weight loss, or massive hormonal changes, something like that. After 2 to 3 months time, you will notice that you are shedding more hairs. I see many patients who come to me and they are like, "Doctor, I have suddenly started to lose many hairs." And when we take history and examine them, we come to know that actually this shedding process has started around 3 months back due to some trigger like major surgery, illness, pregnancy, something like that. That is how it is important to know that what is shedding phase, or what we call as telogen or shedding cycle. Now let's talk about something that many people or many patients are scared about. Why do you see increased hair loss after you start hair loss treatment? So when you start your treatment and actually your hair are growing from the roots, you see those weak hairs and those who are not so strong, they will be shed off because the underlying stronger hair are pushing them so that they can grow back in a more healthier way. So that is the reason why you see hair loss when you start early on your hair treatment journey, or you start minoxidil lotion and other hair treatments. This is the time you need to understand that you need to continue your treatment in proper way. You need to follow up with your doctor so that you know that your treatment is going in the right direction and you are having improvement in your hair loss problem. Now let's understand what is normal and what is abnormal hair shedding. Normal hair shedding is one which is occurring because of your hair loss cycle. In normal shedding, you will lose hair but your density will be maintained. Whereas in the abnormal hair shedding cycle, you will definitely lose your hair, but gradually your hair volume, hair thickness will go down and you will see thinning or bald patches. So this is how you can understand, is your hair loss or hair shedding, is it a normal thing or not? Let me summarize. Hair shedding is not always synonymous to your hair loss problem. Now you understand, knowing your hair loss cycle, why medical treatments take time to show result after your hair loss problem. And definitely leaving treatment within 30 days of starting your treatment is not a good option, as your hairs will follow the defined cycle pattern, which is the way we have just seen. And patience is not optional. You need to keep patient if you want good result with your hair treatment. If you understand your hair growth cycle properly, you will now stop panicking and you will make right decision for yourself. So if you want to know more about scientific hair information, do subscribe to our channel. Thank you.